Dr. Guleria, do you feel, is it your sense that the finance minister, in consultation, of course, with the health ministry, should provide some kind of differentiated approach for urban centers versus what happens with the rest of the country in terms of spending and planning? Because if you look at the data, we crossed the 10 million mark, but half the cases have come from 47 of India's 700 plus districts. Delhi, within that, the entire area, which is 6 districts, has the highest caseload, followed, of course, by places like Mumbai, Thane. Do you think there needs to be a calibrated approach on what we're doing with some of these raging urban pockets versus what's happening in the rest of the nation?
No, I don't think so. I think we need to have a uniform vaccine policy for the simple reason that if you look at parts of urban India, because of the population density and crowding, say, number of people per square kilometer being much higher, and the initial stage, the vaccine actually the virus coming from outside, there was increase in number of cases in metropolitan cities and urban cities. And that is why that there seems to be a huge number of cases there, because the population density is much higher there. But if we have to really do two things, that is, one is decrease our mortality, especially among the high risk group, the elderly, and also break the chain of transmission, that is, bring down our cases dramatically, then this effort has to be across the country, both in urban and rural area, because we have to decrease mortality no matter where the individual is. If he falls into the high risk group, he's an elderly person, he has comorbidities, and also, yeah, if there are sort of cases in a pocket, we can't ignore that even if it's in rural India. So I think the program of vaccination has to be done throughout the country, both in urban and rural part of the country.